Hi, my name is Aaron Hale, and I'm in the class Family 150, Section 04. And today I'm going to talk a little bit about the career profile that I chose to do, which is a Social and Community Service Manager. So a Social and Community Service Manager coordinates and supervises social service programs and also community organizations. They will also direct and lead staff who provide social services to the public. And so they do a variety of tasks and they have different duties depending on demographics and where they work and whatnot. But the typical social and community service manager will discuss with members of the community what types of programs and services are needed. They'll design and oversee programs to meet the needs of the community around them. They'll also suggest and carry out improvements to certain programs and services. They'll also get funding for programs through the agency's budget process or fundraising. And they also analyze data and do certain things like that as well. Now, I actually got to look up information about an organization, and they were North Shore Senior Center, and this was in Northfield, Illinois. And they have various other centers around the United States, but I focused on this one in Illinois. The working environment was a variety of different settings. Sometimes your work will be in different clinics or hospitals, and other times you'll be positioned in offices or perhaps shelters, depending on your work. You'll also help plan for community projects outside as well. This job is considered full-time and occasionally working late depending on each project, whether budgeting or finances. Some social and community service managers will focus more on a certain population of people, such as homeless people or children. Occasionally there's work that needs to be done that will focus on helping people in certain challenges, such as finding a job or whatnot. Much like any other job, there's stressors that come along with this. I think with this career path, it really depends on the day or time or period in society. For example, for those who are working on fundraisers or budgeting, it may very well be stressful to crunch all those numbers in a timely manner. This can be particularly stressful if the community or country you're working in has some economic droughts at the time. Oftentimes there's significant caseloads that you'll have to meet deadlines, complete all the paperwork, and properly document and do some of the billing. You also have to manage changing priorities quickly in various cases. And there is traveling among the community, so this could be stressful for some of us. So some of the benefits, I was trying to find or track down some of the benefits. I didn't really talk too much about some of the healthcare plans or financial benefits that come along with this certain career. I'm sure it depends on the organization you work for, but it very well could be that you create your own health plan or do it kind of outside of that career. So some of the tasks, like I said earlier, is the duties really are based on the size of the organization and the individual. So typically social and community managers will discuss with members of the community what types of programs and services are needed, and they'll manage the budgets and acquire funding for programs through the budgeting. So there is an education requirement. The minimum requirement is to have a bachelor's degree in some human relation degree, such as social work, public administration, family studies, or some related field. Most employers want you to have work experience, especially if you only have a bachelor's degree. A master's degree is really preferred, but if you can show them that you have a lot of experience or background with public policy or program management, that really helps. The career that I looked up, it actually wanted you to be a board certified case manager through the Commission for Case Manager certification. And so the starting salary, like most careers, it depends on the demographics. Some areas of this job will pay more than others, and depending if you work for local or state governments, individual services, rehabilitation centers, or residential care facilities. The average is about $57,000 annually, and you'll start off closer to around $30,000. But the top 10% said they were making about $96,000 and higher a year. So due to the aging population and employment is expected to grow, quite rapidly. It's supposed to grow much faster than the average of all occupations. Because of the elderly, there are communities that will need to be increasing programs for them and to develop and implement these programs. So although the occupation is growing quite fast, there is still going to be limitations due to budget cuts in some states and local governments as well. And so that's a little bit about my career profile. Thank you.